Enid. It's Maggie and Ray from the Health Department. We are excited to just give you an update about what we're doing at the Health Department and other health issues. I'm going to take my mask off so you can hear me. Ray and I are 6 feet apart, and it's on my head. That's good luck. Happy Friday, happy back to school. I know that my family is getting ready to go back to school, and one of the buzz around the health department is school immunizations. We are trying to get all of our Garfield County families caught up on their vaccinations so they can be ready for pre-K and 7th grade. So, that's important to us. We want to continue to make sure, while we have COVID going on, that we don't have other outbreaks of other illnesses that we can prevent with vaccines. So I wanted to do a quick COVID update. Do you guys have slides that I sent? We just have 174 active cases right now in Garfield County. That's 555 total positive cases have occurred here. And passing that 500 mark was kind of a big milestone for us in our population size. So having 174 active cases too is it's a lot. It's a lot of us that are being impacted by this virus. So we've unfortunately also had 7 deaths now in Garfield County. We had 2 more pop up this week. So we hate to see that, and that's why we're continuing to encourage our community to rally together and to keep distance when you can, keep 6 feet apart, wear your masks when you're not able to be socially distanced, and keep washing those hands, doing all the things to keep our vulnerable people safe. The next slide, I wanted to let you know that we are in an orange alert again. So we were at orange, and then last week we went back down to yellow. And as you can see, Garfield County is now orange again, as well as Grant, Major, and Kingfisher County. So that alert lets us know that we have an increase of new cases per day over a week period. So it just shows us that our cases are growing, and they're growing faster. So we're trying to pay attention to that and communicate with our leaders at our city and schools about those numbers so that we can be able to prepare adequately. And the next slide just shows you the graph that they use to get to that orange alert. So you can see we had a little dip down last week, and now we're back up higher. So we're seeing a lot of people have no symptoms, but people are still getting very sick. So do your part, Enid, and let's help each other stay safe, especially with school reopening. I know our Enid schools, I watched all the kiddos at my daughter's school walk in with their masks, and everybody's trying their best. And I just want to thank all of the teachers and all of the staff at the schools who are working so hard to prepare for a year that is unlike any other. They are heroes, and they're dealing with things they've never had to deal with before. So give a teacher a socially distanced fist bump or something this week. And I have Ray here with me to share with you all a few other things we are thinking about at the health department.
Yeah, just wanted to echo Maggie about the importance of just the masks and the hand washing. The interim commissioner for the state of Oklahoma, he's a Colonel Lance Fry, just put out a new advisory yesterday, and he recommends masks for any child over the age 11, child to adult, anyone over the age of 11, masking in restaurants. You can read the full report on the OSDH website. I've posted a link on the Garfield County Health Department page. But that's, he's our new commissioner. It's been about a month or so that he's been in, and this is the first kind of alert that he's put out. So I think it's important for Oklahomans to read what our health commissioner, he's a medical doctor, and to read what his opinions are, because it definitely comes from a place of knowledge. Aside from that, we have some exciting things going on at the health department. We actually have, through COVID, we've received funding to hire some new staff that helps us with the COVID response. So we have, at the Garfield County Health Department now, I think we have 2 nurses, a new nurse practitioner, and some clerical staff, and a courier. So they have taken a huge burden off of our staff at the health department. So that's why we've been able to do the extended schedule for immunizations. So this whole week and all of next week, we are open from 7:30 a.m. to 8 a.m. for immunizations by appointment, 5 to 6 p.m. immunizations by appointment, and then the rest of the day is walk-in. I think they're closed from 11 to 1 to allow the staff to take lunch. But without the help from all these new staff members, we would not be able to provide immunizations to Garfield County, and those immunizations are really important, especially right now. It's also immunization month for the CDC, so sometimes in adults they actually can wear off a little bit, so it's important, if you need to, get your it's called your titers checked, and get those booster shots if you need them. So we're always there and always willing to give people immunizations. They're free for sooner care, and it's just insurance will be billed, and then you'd have to pay some sort of copay with a lot of insurances. And then was there something else I was going to share?
Yeah, we want to just thank all of the staff at the health department, especially our new COVID team. They're really helping out a lot.
Yeah.
What's happening lately is there's some burnout with COVID. I know you may have some burnout hearing about COVID, but for all of our healthcare workers, our hospitals that are taking care of patients, and for those who are testing often, it's a long road. We're still in the middle of the marathon. So also give a nurse a fist bump too.
Nurses and teachers right now, and parents and kids are. I mean, it's a completely new experience for all of us, and the better that we socially distance, band together, the easier it's going to be on the community and us as individuals. The one thing I did want to share is with our new COVID staff, we're now able to, we've always had our family planning services, but now we're able to, really take care of all those needs you may have. So you can come in, get tested, get your meds, and so come and see us. We're back in full swing, and hopefully in the next couple of weeks we can start sharing some information about some other public health issues we have going on, and other things that need to be addressed, because the world we still have other diseases progressing and stuff that have not gone away because of COVID. So we're hoping to spread our wings a little and start reaching other communities and tackling some other issues now that we have the help we need.
Sure. Well, take care of yourselves this weekend. If there's any questions on Facebook, we'd be happy to answer. We want to be a good resource for information. Okay. We're thankful for the City of Enid for this platform, and for all of you for tuning in and keeping up to date with the data and how we are responding to COVID-19 and our other health issues. So have a great weekend and stay well.
Bye, Enid.